All right, so we're going to continue on with our discussion of the diseases of the digestive system, and we're going to look at the diseases of the small intestines next. So when we're looking at the small intestine, one of the main things that we see being an issue is what we call a malabsorption syndrome. When we look at malabsorption, it's where the small intestines is unable to absorb the nutrients like it's supposed to. Now remember, the small intestines, its main goal, its main function is for absorption. Of course, it's digesting as well, but it's to absorb all of those digested particles so that they can enter into the bloodstream. So a lot of times when we talk about the malabsorption syndrome, there's difficulty specifically absorbing fats and minerals. Now, this is linked sometimes to other types of disorders or diseases like diabetes. Also could be linked to individuals who have cystic fibrosis, pancreatic deficiencies, lactose intolerance, and also when you have like a gluten sensitivity like celiac disease, it could be linked to that as well. It's pretty difficult to diagnose, but if it's diagnosed, we do see that the treatment most of the time is diet therapy. So this would be adjusting the diet in order for it to allow the intestines to be as successful as possible with its absorption. Now, some complications that can occur when we talk about malabsorption syndrome is a bleeding issue. When we look at bleeding and clotting is going to require a couple of different things. Calcium is one of them, but so is vitamin K. So if vitamin K is not being absorbed like it should from your diet, we do see that there's an increased chance of bleeding. All right, so the next one we want to look at is regional enteritis. Regional enteritis is also known as Crohn's disease. It may be classified as an inflammatory bowel disease, or what we call IBD. So a lot of times individuals will be diagnosed with inflammatory bowel disease first because that's more general in terms, but as they do more research and more diagnostic tests, they may be able to pinpoint that it's what we would call regional enteritis or Crohn's disease. Now the cause, guys, this is kind of hard because we're not sure what causes this. There could be a genetic predisposition. There could be an immunosuppression or immunosensitivity that's occurring. We also see it could be triggered by some sort of infection. It could be infectious, or it could also be what we would consider psychological. And it could actually be a combination of a lot of these things, but we're not exactly sure. Now, this is going to be chronic inflammatory disease, and it's most commonly affecting the small intestine. Now, the problem here is this inflammation being chronic actually causes the lining to start to thicken of the small intestines. When it does that, it starts to thicken, the lumen or the hole starts to get smaller, which makes it more difficult for food to move through. It is characterized a lot of times by remissions and exacerbations. So remissions are times when they feel better and don't have many issues or problems, and exacerbations are when, of course, the symptoms get worse. So some symptoms here, we do see anorexia. They're not wanting to eat. They're not wanting to be able to absorb the nutrients and all because moving the food is difficult. Flatulence is also part of this, abdominal pain, and then diarrhea and constipation. And a lot of times it can go back and forth between these depending on what was consumed or eaten. Some supportive treatment would be a low residue diet. A lot of times individuals with this will actually have to go through and pick out and figure out what things make it worse versus things that don't bother their digestion as much. And so cutting out certain foods may be beneficial to them. Also, medications that will help control their diarrhea, the inflammation, infection, and even depression from this type of disorder may need to be provided. The next one we look at is gastroenteritis. This is an inflammation of the stomach and intestines because gastro means stomach, enteritis means intestines. When we look at this, there can be lots of different causes of gastroenteritis. It could be a bacterial infection. It could be viral. We also could have a parasitic invasion, specifically like types of worms, whether they're round or flatworms. If you ingest tainted food, and so if it was contaminated, this would be a type of like food poisoning. Lactose intolerance, they consume an individual who cannot digest the lactose sugar properly, could end up causing this to get inflamed due to taking in that sugar. Allergic reactions to certain foods or drugs, and even stress could trigger this. So what are some symptoms of gastroenteritis? When we look at symptoms, the patient may deal with nausea, then vomiting. They may have abdominal cramps, diarrhea. Their stomach may rumble, have a rumbling type of issue that's happening, and they may also deal with malaise. Okay, remember malaise is just where they feel blah, they don't feel very good. Okay, and it's getting to that point where their body just is getting more fatigued in that. Now, when we look at treatment for gastroenteritis, so anti-nausea and anti-diarrheal medications may need to be given. This is important because it's to help reduce the loss of water and to decrease the chances of dehydration in this state. We also see antibiotics, if we're talking about a bacterial infection, may need to be prescribed. Fluids, making sure that we're getting enough fluids in, again, to prevent dehydration, and maybe even some nutritional support if that inflammation becomes too great. So what are some ways to prevent this? A lot of times this comes from an invader, and so hand washing prior to food preparation is really important. Also, making sure your food is refrigerated properly. When we refrigerate things properly, it's going to help prevent the growth of certain bacteria and all. And then avoidance of contaminated food and or water. All right, so now we're going to move on to the inguinal hernia. This is going to be where there's an outpouching of the small intestines and the peritoneum. Remember, the peritoneum is a special covering, the serous covering that covers your digestive organs, specifically the organs of the abdomen. And what happens here is that there is a break that happens and then it protrudes through. Anytime we talk about a hernia, it's an area protruding somewhere it should not go. And in this case, it's going into the groin area because it's talking about inguinal. Now, this can happen pretty much anywhere in the abdomen, but this is one of the most common areas. We also find that this particular type of hernia is more common in males. And we do see some complications that can occur with this. We do see that a lot of times the kind of symptoms that we see with an inguinal hernia is going to be a bulge that takes place. You can actually feel it and palpate that there is an issue. Pain will a lot of times come along with it, as well as nausea and vomiting. If there is a area of that particular part of the intestines that starts to lose blood flow, this is known as a strangulated hernia, and this is going to be where it gets twisted up, and as it's twisted up, the cutoff of the blood flow causes that part of the organ to potentially die. This would be a case that's very complicated and needs to be fixed as soon as possible. Now, how do we normally diagnose a hernia? Of course, the palpating the area could be beneficial. Sometimes it cannot be felt, and so we need to look for it with an ultrasound and maybe even a CT scan. Now, with treatment, we would see that with surgical repair needs to be done. What they'll do is they will open up, as long as it's not dead tissue of the intestines, they'll just push it back into the place it's supposed to be in the abdomen. And then they'll sew up the peritoneum as well as reinforce the area so that it's not going to stay weak. Because normally it was a weakened area in your abdominal wall that it pushed through. So they'll reinforce it a lot of times with like a mesh to help make sure that it doesn't do that again. Another thing, though, is prevention-wise. We can prevent a lot of times these inguinal hernias in a number of ways. One is managing our body weight. Of course, if we can keep an ideal or good body weight that's not too heavy, that's going to help, as well as stop smoking. Proper body mechanics when lifting. A lot of times we see that this is an issue more in males because of them lifting heavier weights, lifting heavier things. And so with that, if you're not using the proper body mechanics, you can actually increase your risk of developing this type of hernia. We also see that avoid straining when you're going to the bathroom. This is another thing that could potentially cause a hernia to develop. All right, so now let's look at diseases of the colon. So we're moving our way down, and the colon diseases often require a lot of times a surgical resection where we have to take a piece of the colon out. Hemicolectomy, this is going to be a partial removal of a section of the colon. And so a lot of times what happens here is they'll take a piece of it out and then they'll do what we call an anastomosis where they're going to reconnect the two ends. So we're going to take a portion out and then we're going to take those two open ends and we're going to reconnect them. This just makes the colon, the actual large intestines, a little smaller. We also see that there could be a colectomy. This is removal of the entire colon. And if this happens, guys, then the patient normally will have to have a colostomy. A colostomy could be temporary or permanent, and it's an opening in the colon that is to the outside of the body. The stoma is going to be the opening in the abdominal wall, and they'll normally need what we call ostomy supplies, which is going to be pieces that are applications to that opening, and feces would be collected in a bag outside of the body instead of going through its normal cycle through the intestines. This bag then has to be changed out periodically because it fills, of course, within feces. This is not something that normally people will really want to do, but because the colon could be diseased or have issues, removing that, this might be the only option. All right, so let's look at some issues with the colon, and we're going to start first with appendicitis. When we talk about appendicitis, this is of course inflammation of the appendix. Now the appendix, if you recall, is on the very tip of the colon, right where the small intestines comes in and meets with that large intestines. When we look at this, guys, it is a worm-like structure, okay? So it has this kind of worm-like structure, and we don't really know exactly what it does. We believe that it could potentially have something to do with like your lymphatic system, but right now it's considered more of a vestigial organ. It probably had bigger roles in the past, but we don't really know what it does now. Now, symptoms with appendicitis, we see abdominal pain. This abdominal pain, though, will shift specifically to the right lower quadrant. Okay, so remember, if we took your abdominal cavity and we made it into quadrants going through your belly button, it's going to be the right lower side. It does cause nausea and vomiting, fever, leukocytosis, which is an increased white blood cell count, and we need to get this out hopefully before it ruptures, okay? And so we need to get the appendix out. Now, surgical excision needs to be done, and again, preferably before the rupture. If a rupture takes place, the contents of that large intestines is going to get out into the abdomen, and this can end up causing further infection and even sepsis. This again could cause the patient to go into shock and could cause death. The next one we want to look at is intestinal obstruction. This is the inability to move contents through the intestines like it should. So there's a blockage that takes place. Now there's a number of ways that this can happen. The blockage could be due to the development of tumors. It could be due to a hernia where we see that a piece of the intestines is herniating out where it shouldn't go. It may also be to adhesions where the sides are connecting where they're not supposed to. So again, stuff can't get through. It could also be what we call a volvulus. Volvulus is going to be where the intestines gets twisted up and kinked. Or it could be what we call an intuspection. An intuspection is going to be where it'll actually telescope on itself, where it'll start to infold and kind of telescope to where there will be a blockage, a thinner area in that lumen where the hole gets smaller. Disease could also be an issue that triggers this. Ileus is another one. Ileus is an absence of the peristalsis. This is where the intestine is supposed to be triggered to move the food forward through that peristalsis movement of those smooth muscles, and this is not happening. This could progress into what we call paralytic obstruction. A paralytic obstruction is when the colon action is paralyzed, and so these muscles are not able to move at all. So symptoms, it depends on the severity and the type of obstruction that we see, but we do see it could be mild to severe abdominal pain, okay, again, depending on the amount of the obstruction or what type. And we also see a lot of times distension of the belly that takes place, kind of like a retaining of fluid. Nausea and vomiting also could be a big time symptom. Now, when we look at this, guys, one way to help prevent some of this and this whole idea of disease is if it's due to tumors or hernias, we need to treat those as soon as possible to help prevent an obstruction. Another case, though, is other treatments may need to include what we call a nasogastric suctioning. Now, this is going to mean that the tube is going to go through the nose, down the throat into the stomach, where they're going to be able to suction out solids, liquids, and gases out of the stomach and small intestine. If this is not successful, in order of removing the blockage, surgery may need to then be performed. The next one we want to look at is ulcerative colitis. When we look at this, this is also going to be chronic inflammation of the colon. This is another one that normally starts out as inflammatory bowel disease, and then we can specifically pinpoint it to ulcerative colitis after more tests. Symptoms are lower abdominal pain. There'll normally be blood in the stool. They'll be anemic. The patient will be anemic, and they may also have a lot of diarrhea. Now, one thing with this, guys, is of course we would take stool samples when we're talking about diagnosis for the blood in the stool. But we would also want to do a blood test to see if the patient is actually anemic, where they're losing too much of that blood. So some things that potentially cause this type of disorder, this type of inflammation, some factors could be what we call the psychogenic factors. Again, more of a psychological side that could also play a role. Heredity, autoimmune issues, dietary factors. And guys, an issue with this is it actually can also increase the risk of colon cancer. So this is something we would want to treat in order to help reduce that risk of colon cancer developing. The main way to diagnose this is through a colonoscopy, okay? Going in there and being able to actually get a picture of what's happening. Now, this is going to be very distinct in the fact that inflammation is taking place as well as lesions. There's going to be actual lesions in the colon that can be visualized. Treatment. Dietary limitations may need to be put into place. Certain foods could aggravate this and cause more inflammation. Stress reduction. Mild sedatives may need to be given, and also anti-inflammatories. Now, if none of these above treatments are actually working, surgery is going to have to be done. So they want to use these more like non-invasive treatments first, but again, if they're not able to be successful with that, surgery will be the treatment that will follow. All right, the next one we're looking at is irritable bowel syndrome, or IBS. This is also known as a spastic colon. This is a little different than what we talked about with the inflammatory bowel disease. It sometimes is categorized as an inflammatory bowel problem, but it really isn't, because it does not have inflammation and lesions present. Those are going to be present almost all the time when we talk about inflammatory bowel disease. So it gets confused sometimes. This is actually the most common intestinal disorder that we have. Symptoms include abdominal pain. We see an altered motility in how the food and the feces moves through these structures. And then also we have diarrhea or constipation. And a lot of times they will switch back and forth between these. They'll have a period of they'll have a period of time where diarrhea is more of an issue and a period of time where constipation may be more of an issue. Now, the cause of irritable bowel syndrome is unknown. Some underlying potential issues could be, when we look at stress, it could be certain food that they're consuming could cause irritations. We do see that a lot of times it manifests in young adults, and then it continues and persists throughout their life, which can be very kind of annoying to the individual who has to deal with this. Irritants to the colon could bring on symptoms, and these irritants could be spicy foods or certain seasonings, so they may be able to identify and cut those out. Caffeine, alcohol, and even stress. And so again, treatment may revolve around avoiding these irritants or these triggers that may cause an exacerbation in their bowels, that spastic colon. We then see too, stress reduction may need to be done. The next one we want to look at is dysentery. Dysentery is an acute inflammation of the colon. It is normally caused by some sort of infection, and a lot of times it's going to be bacterial. Okay, a lot of times it's a type of bacterial infection that occurs. It's an invasion of a microorganism, and this can be through contaminated food, water, or both. Now, we do see this as more of an issue in underdeveloped countries, okay, where their development is kind of behind when we talk about, like water purification and sewage and that kind of thing. And so we see it more of an issue in those countries. And then we also see it in individuals who travel a lot to those countries. Now, when we look at this in the United States, individuals that deal most of the time with dysentery are going to be immigrants who, of course, are coming from a lot of those underdeveloped countries. Inner city housing, individuals who live in inner city housing sometimes may have an issue with dysentery. Individuals who travel frequently may be exposed more often. Children in daycare, and also individuals in nursing homes. And this a lot of times has to do with poor hygiene. That is an issue when we try to teach kids proper hygiene, but also as individuals get older and they have the dementia or issues that put them in a nursing home, hygiene may also be decreased. Now, the main symptom for dysentery is massive diarrhea, but this diarrhea, not to be confused with just somebody who has diarrhea, will normally have blood, pus, and mucus in it. This is also going to cause severe abdominal pain, and it can cause dehydration very quickly. The treatment is dependent on the cause. A lot of times, if it's bacterial, antibiotics are going to need to be used to fight that infection. There are some preventative measures when we talk about this. Of course, it could be proper hand washing, making sure that you wash your hands properly. Do not share straws or utensils with individuals, because if they have it, it could spread very easily to you in those cases. If you do travel to certain countries that are at a higher risk because they're underdeveloped, you don't want to drink the water from those countries or even eat the ice or consume ice from that because it's made with potentially the contaminated water. But also eating salads or fresh fruits and vegetables could also cause that issue because of how they were maybe washed or watered as they grow, and so they could be potentially contaminated. The next one we want to look at is diverticulosis and diverticulitis. Now, diverticulosis is a condition of diverticula, and diverticula is where there's little pouches that are forming in the colon. You can kind of see them in this picture. Now, diverticulitis is where those pouches, those out pouches, become packed with fecal matter or become irritated or inflamed due to something getting stuck in there. A lot of times this can come from certain foods, especially foods that have small seeds like strawberries. Hey, those small seeds might get embedded in there and they cause inflammation to occur. We do see that this tends to increase with age. Okay, because as we age, more of these kind of diverticulos do occur, and then also motility decreases and how our food moves through those systems. Poor dietary habits could also contribute to this, lack of physical activity, and even poor bowel habits. Now, when we talk about poor bowel habits, this is going to be where you hold it too long, you do not follow the reflexes a lot of times, and when you need to release, and you're using too much force to try to push feces out. All those are what we consider poor bowel habits. Another thing we do see symptom-wise is lower abdominal pain and cramping that takes place with diverticulus. It can progress and complicate into hemorrhaging, perforation, and even a narrowing of the lumen, okay? The whole narrowing to where movement of food can't occur like it's supposed to. Treatment, increased dietary fiber. Now, fiber can be increased through certain foods like fruits, vegetables, beans, potatoes, rice, and cereals. Those all are high in fiber, which actually helps the movement of food through your digestive system. It helps keep things more regular, which can help prevent this from occurring. And then antibiotics, if we do see that there's bacterial infection that takes place. Okay, if there's a secondary type of bacterial issue, antibiotics may need to be provided. The next one we want to look at are called polyps, and these are found in the colon. They are inward projections of the mucosal lining of the colon. A lot of times these are caused by an inflammatory reaction, or they're due to a type of neoplasm, which is an overgrowth. Now, these could be benign tumors, or they could be malignant tumors, which would be classified as cancer. Diagnosis of polyps, guys, is going to come a lot of times from a colonoscopy or what we call sigmoidoscopy. That's just where if you go into the first little part of the colon from the rectum or anus area. Those areas are going to show they have these little pouches, and they're going to be able to see them. Now, the big thing with this is they will normally biopsy any that looks suspicious. If they look abnormal or they're too large, they'll biopsy that, and then they will look to see what the ultimate cause is. If it is cancerous, we do need to treat that as soon as possible. A lot of times, guys, polyps are going to be asymptomatic, so they're normally going to be found just in a routine colonoscopy once you hit a certain age. Ways to help prevent these from forming is, of course, to eat healthy, limit your fat intake, limit alcohol, stop smoking, maintain a good body weight, and also exercise. Again, these are kind of the normal things that help across the board when we talk about diseases, but they could help prevent or reduce your risk of developing polyps. Now, polyps could obviously be a bigger issue, especially if we do a biopsy and find out that they are cancerous. This is where we see carcinoma of the colon or the rectum. It's commonly called colorectal cancer. This is one of the leading causes of death when we talk about cancer in the United States. Now, when we look at symptoms of a carcinoma or colorectal cancer, it's going to be changes in bowel habits that happen. Okay, the stools start to be more pencil-like in size. Blood can happen in the stools. The patient may become anemic due to that blood loss. They may also have abdominal discomfort and even obstruction. Now, the most common type of this cancer is what we call an adenocarcinoma. Adenocarcinomas are actually going to grow pretty slowly. However, they can metastasize. If they do metastasize out of the colon area, a lot of times they'll travel through the blood or lymph system to the liver. That's where we'll find a lot of times secondary tumors, but it could travel anywhere. Diagnosis is going to happen by a barium enema most of the time. They may also do stool exams to look for blood. They may also do what we call a Cologuard test. Now, Cologuard tests can be done at home, and they're a non-invasive type of screening. A lot of times they are going to be prescribed sometimes for patients to use when they hit 45 or older. And then this would be between potential colonoscopies that they may be having. Okay, colonoscopies are something that a lot of times each year might need to be performed, but now if they don't find anything that's dangerous, they could do the Cologuard Cologuard test in between those colonoscopies to where they don't have to happen as regularly. Now, prevention is diet, okay, changing potentially some of the diet and watching that kind of thing. Again, eating a healthy diet, staying away from fats, that kind of stuff. And then also stool examinations could help. If we look at the stool, which is kind of weird to think about, but there is a scale of what stool should look like. And if you're staying more in that middle ranged area where the stool stays more normal, then you're okay. But if we go to either extreme, we might have more issues, and this could be one of the issues. All right, moving down even further, we're moving towards the outside of the body, and we're going to get to the diseases of the rectum. One of the main diseases of the rectum is what we look at for hemorrhoids. Hemorrhoids, guys, are varicose veins in the rectum. Now, remember, varicose veins are when the veins are going to bulge. They're not sending the blood back like they're supposed to, and a lot of times we see this in the legs. However, it can also occur in this area, and causes are going to be due to pressure in the anal area, just like pressure on the legs causes varicose veins to develop. Constipation, prolonged sitting or standing could increase the risk, and also pregnancy and childbirth. A lot of women who end up that are pregnant or give birth may deal with hemorrhoids at some point during that pregnancy or after. We do see that symptoms include itching, bleeding with bowel movements, as well as rectal pain. Okay, so those are normally the symptoms you see with hemorrhoids. For treatment, guys, we see medications, warm sitz baths. Those are going to be more for easing pain, okay, the treatment of the pain that comes along with hemorrhoids. Manual reduction, chirosurgery, and also what we would call a hemorrhoidectomy. Those may need to be done, and they're optional to help remove or reduce the presence of those hemorrhoids. Okay, because a lot of times those hemorrhoids are going to be protrusions out of the anus from rectal tissue on the inside that should stay on the inside, and we may need to reduce those somehow. Prevention. How can we prevent hemorrhoids? Well, stool softeners. If our stool is not too hard and we don't have to strain as much in order to release it, it helps prevent hemorrhoids as well as hernias. Good bowel habits. Again, using our reflexes like we're supposed to, and helping us remove those are going to remove the feces is going to help. Fluids and fiber, keeping things moving. Exercise, and also avoidance of laxatives. Using laxatives could increase the risk. All right, switching gears, let's talk about some trauma. When we look at trauma can happen to the mouth. When we talk about trauma to the mouth, this could be due to motor vehicle accidents, falls, abuse, burns, or even a blunt or perforating injury to the mouth itself. When we look at this, a lot of times if the mouth is affected, eating is difficult. So if eating is difficult, alternate feedings may need to be done. We may need to supply nutrients in a different way, and this could be through a parenteral route, like through a vein, intravenous, through just the bag, or we may need to actually add a feeding tube. If we're looking at a feeding tube, this is the enteral route, which is going to go into the intestines. Now, these might just be temporary until healing happens in the jaw area, mouth area, teeth area, but it could be more long-term depending on the extent of the damage. Another trauma could happen to the stomach or intestines. This is going to be where they actually break a perforation that results in opening in the organ. This could be due to any kind of like stabbing, gunshot wound, or something actually impaling the individual. This is a medical emergency because the contents of the stomach and intestine have those toxins we talked about, whether it's acid or bacteria or enzymes that are going to potentially break things apart, and we don't want that leaking into the abdominal cavity, so this is considered a medical emergency. Treatment is usually surgical to close up those holes, and then antibiotics may need to be given after the surgery in order to help prevent infection. All right, so let's take a look at some of these rare diseases. So achalasia is another one that we look at for rare diseases, and it's a disorder of the esophagus. And so the esophagus remembers the connection between your throat and your stomach. What happens with this is this disorder causes pain when you swallow as it moves down the esophagus. There's an unknown cause to this, and the symptoms are just that pain. The main way that we would treat this is maybe surgery and also drug therapies, as well as maybe a combination of both. Another one is the gluten-induced enteropathy. This is also known as the celiac disease. In this case, the individual has a sensitivity or an intolerance to wheat, rye. Sometimes it even can extend into oats and barley. This is going to be an immune problem, and it causes that sensitivity to those gluten products. So if an individual is to eat gluten or anything that has gluten products in it, it does cause more pain and discomfort and digestion. One thing with this, guys, is that we've actually seen an increase in rise of this diagnostically. Now, there could be two reasons for this. One, it could be the way that we preserve our food and add a lot of additives that have gluten into our food. But another thing could be due to self-diagnosis, where individuals find that if they cut out gluten, they start to feel better. And so they kind of self-diagnose as having celiac disease, when in reality they really don't. They may have a slight sensitivity to it, but it's not going to be a big problem like you would see with celiacs. Another one that we talk about rare diseases is intestinal polyps. These are benign tumors. They're found along the intestinal lining. There's really no symptoms that come along with these, and often surgical removal is just to prevent cancer, because a lot of times if we have a benign growth, there could be a chance that mutation could occur where it would turn into a cancerous growth, and so we'd want to watch for that. The last thing we want to discuss here are the effects of aging. When we age, just like any other system in our body, the digestive system starts to be affected, and disorders start to become more common. As we age, we see an increased risk as well as increased occurrence of some of these different disorders that we discussed. We also see that there's a loss of teeth that happens, which obviously could affect how you eat, decreased sense of taste, increased incidence of ulcer diseases. This could be due to changes in the stomach lining that are occurring, as well as changes in the amount of acid produced by the stomach, as well as decreased circulation of the blood to the stomach. So it's kind of like this, and this all cause potential issues that could increase the chances of ulcers developing. Constipation problems tend to become more of an issue the older we get. This is one reason why certain kinds of supplements or even things like yogurts are something that older individuals should continue to consume, because it can help keep them more regular. And then development of hemorrhoids. Now, guys, a lot of these could potentially be linked to issues that they had when they were younger, and they just become exacerbated more as they age. All right, so this is just some of the ideas of effects of aging. Now, if you have any questions or concerns, please let me know. Have a great day.